So they're probably not in here. They're probably over at the library making copies. But somebody stepped out of the lab with volume 2 Fergie's. There it is. Okay. It needs to be returned as soon as we're done here. Okay, thank you. So tonight we are talking about the respiratory system and the diseases that are associated with it. First, let's talk about the anatomy of the respiratory system. We can divide it up into two halves, if you will. There's the upper respiratory system and the lower respiratory system. The upper respiratory system then, of course, is going to include the nose and the mouth and the pharynx, the sinuses and the throat. And then the lower respiratory system, that's going to be the trachea, the lungs, the bronchioles. If you think about the environment of the respiratory system, it's a relatively hot and humid environment. That's a pretty good environment for bacterial growth. In addition to that, we're going to see that there's less O2 in this environment and a greater concentration of CO2. So microbes that prefer an elevated CO2 environment might do well here in the respiratory system. Portals of entry, your eyes, your ears, your nose, your mouth, all of them can serve as ways for the microbe to get into the respiratory system. When we look at some of the details of the respiratory system, we see that there are specialized cells called goblet cells that produce mucus, that secrete mucus. And so lining the respiratory tract, mixed in among the epithelial cells that are there, you'll find these goblet cells that are secreting mucus. In addition to that, the epithelial cells that are there are ciliated. And so those cells, those ciliated cells, serve to sweep the mucus up out of the respiratory system. And the function of the mucus there is to collect microbes and debris and stuff that you're inhaling. And so it gets caught up in the mucus, and then you can sweep that mucus out, you can swallow it, you can expectorate it. It serves to keep your lungs clear of bacteria, clear of debris. If you're a smoker, you can damage the cilia of the cells. As the cilia become damaged, they don't work as effectively at moving the mucus out of the respiratory system. They damage what is called the mucociliary escalator. And so then, how do you get rid of it? You develop a cough. Is that a smoker's cough? A lot of times in the morning, individuals that smoke regularly, because that mucus has been gathering overnight and needs to be expectorated, you'll hear that smoker's cough in the morning from people that smoke heavily. Let's consider the normal flora here of our respiratory system, or our normal microbiota. There are numerous bacteria that can colonize our nasal passages and colonize our throat and our pharynx. Some of those include diphtheroids. Some Staphylococcus strains were found there as well. We can also find some Streptococcus strains, and I'm going to talk about these guys here in some detail real soon. About 20% of the population will have Staphylococcus aureus as part of their normal microbiota. More so if you're in the health fields. Strep is found deeper down into the respiratory system, further down into the pharynx and into the throat. If you're going to swab for strep, you're going to do a deep swab. Let's talk about this microbe here for a second. Now I'm going to talk about a specific microbe, Streptococcus pyogenes. This microbe has one that causes a number of different illnesses, diseases, and has a number of mechanisms it can use to avoid the host. It's a gram-positive microbe. It's an air-tolerant anaerobe. It grows in chains, you know, all that stuff. I won't test you on, just kind of give you a feel for what we're talking about here. And it is spread by droplet nuclei. Direct contact, so if someone's infected, they can pass it on to you. You'll find it in having the throat, the nostrils, and a lot of people, it does nothing to them or doesn't cause them any ill, unless of course their immune system becomes depressed. And then the microbe can cause an illness. One of the conditions that Streptococcus pyogenes causes is puerperal fever. Puerperal fever is an infection of the uterus, a bacterial infection of the uterus, also known as childbed fever. This was a big problem in the late 17th, early 18th centuries. About this time, there emerged these things called lying-in hospitals. These were hospitals that poor women would go to deliver. And the thing was is that in most of these hospitals, you had male midwives. And we didn't understand the connection between bacteria and infection. And so these male midwives would move from one patient to another patient after examination. And so they would then cross-contaminate, if you will, the women that were in these hospitals. Larger hospitals, you could have as many as 20% of the women contaminated with Streptococcus pyogenes shortly after giving birth. In smaller hospitals, that number could jump as high as 70 to 100%, especially if you've got one or two physicians that are moving around between all of the patients. So now all of the patients are becoming infected with Streptococcus pyogenes. A lot of times, this infection would lead to the death of the mother, especially in the late 17th and 18th centuries when our practice for treating the illness was bleeding and purging and leeches and things like that, that of course just made the condition worse. In 1841, try to say his name, Ignaz Semmelweis, was working at a hospital in Vienna, one of the famous teaching hospitals, and it had been separated into two wards. One ward that was strictly doctors and students in the medical profession, and the other ward was just female midwives. And what Ignaz had observed is that in the ward where the doctors were, there was a much higher incidence of puerperal fever. And actually, he had just lost one of his best friends that had been doing surgery, and he had cut himself during the surgery. He had become infected with Streptococcus pyogenes, and it led to his death. And this led to Semmelweis to start to observe the practices of the individuals that were working in these two wards. And what he noticed is that in the ward with the hospital, there was a much higher incidence of, or I should say the ward with the doctors, there was a much higher incidence of puerperal fever. And he observed these doctors, again, moving from operation to vaginal examination to operation, back to examination, without ever washing their hands or doing anything. Noticed in the midwives that they were much more apt to wash their hands between visits. They weren't doing surgery, so they weren't necessarily contaminating themselves after surgery and during surgery. And so he implemented this procedure of washing your hands prior to surgery and washing your hands after surgery. And you saw the incidence of puerperal fever drop significantly from just implementing that one procedure. Now, it took over 40 years before the rest of medicine caught on, but saved a number of lives simply from implementing a hygiene protocol, if you will, that prevent the spread of the microbe. Now we would never think about moving from operation into an examination without first cleaning up. Other things that we might see with Streptococcus pyogenes. Oh, I should say, I'm sorry, I lost track of what I was saying. I should say, puerperal fever is not nearly the problem it was a couple hundred years ago, but it's still an issue in poor countries today. Of course, in American stuff where we have better medical practices, better hygiene, cross-contamination generally isn't happening, and we have the medication to treat for it. So we're not seeing the incidence that we might have seen 200 or 300 years ago, but still in poor countries where you don't necessarily have the same education, same practices, we do see a higher case of puerperal fever. Strep throat, another thing caused by Streptococcus pyogenes. This is an inflammation of the pharynx. You'll get swollen lymph nodes. You might get some pus-producing abscesses. Scarlet fever is another condition produced by S. pyogenes. This condition involves a lysogenized strain of the microbe. So what does that mean then? Say that again? No, it means that it's been infected by a virus. So the virus itself actually is responsible for the effect here. Now we're talking about a toxin that's being produced. So it's lysogenized, infected by a virus. That allows it then to produce a toxin. You can get a rash that develops, you can get a red tongue that comes from this. Skin can slough off. A pyoderma. Now this is a skin infection actually that happens. We're associating it with respiratory because you have to inhale the microbe, but it can cause a skin condition as well. You get lesions that occur on the skin, sometimes referred to as impetigo. Requires direct contact. Here's a fun one. Necrotizing fasciitis, flesh-eating disease. In this case here, the microbe grows along the fascia and, if you will, destroys the muscle tissue. Secretes an enzyme that destroys the muscle tissue. So the bacteria now, they spread down along the fascia of the muscle. The fascia is that connective tissue that surrounds the muscle fibers.
Now, how did that develop? Because my neighbor had that, and it started off really small. He ended up losing his leg due to that.
Okay, so in this case here, you're not inhaling the microbe. You actually have to have the microbe exposed to the the damage, the trauma on the skin. So somewhere along the line, that microbe got into that wound and then started to spread along the fascia there.
So can the wound heal and then show up somewhere else? Say open up as a new wound?
Well, you can get a toxemia that develops as the toxin moves into the circulatory system, and so it can be circulated around, so maybe that toxin could cause damage elsewhere. That's what I'm thinking there. I don't know if the microbe could move to another spot and cause the infection elsewhere. I don't know that. You can get rheumatic fever. You can get glomerular nephritis. That's a hard one for me to say. So my point here in throwing all of these up is that you can see this one microbe causes several different conditions. And what we've got listed here, 7 different conditions, and this probably isn't all of them. There are other things that may be responsible for as well. How is it then that this